Talking about gender affirming top surgery today, and I would like to continue that discussion with how we will get your insurance to approve the surgery, details of the surgery, and what to expect after surgery. At first, what we will need is a letter from your behavioral health therapist. This will support your decision to proceed with gender affirming top surgery. I will give you the contact to my secretary, Mona. Once she receives that letter, she'll submit it to your insurance. Typically takes 6 to 8 weeks to hear back from your insurance. Once we have the approval, she'll give you a surgery date. She will then make an appointment for you to see me 1 to 2 weeks before surgery so we can talk about these issues one more time and address any concerns that you might have. If you were to smoke or be around people who smoke, you will be provided with a urine nicotine test or drug screen. You can go to any Henry Ford site and have your urine tested. Once it's clear, she will give you a surgery date. Typically takes around 6 to 8 weeks to have your urine clear. After surgery, I will let you know when it's safe to restart. It's not safe right away. It will take, again, 6 to 8 weeks for you to be fully healed before it'll be safe to restart, and I'll be sure to tell you when it's safe. However, if you've waited this long, it might be something to consider abstaining from or stopping altogether for your health. I understand that this is stating the obvious, but if you were to detransition in the future, I cannot guarantee that I can create the appearance of breast that you currently have. In fact, I cannot. It would require multiple surgeries, and you would likely find it to be disfiguring. In this procedure, I have to remove the nipple and reapply it. The way the nipple feels will be numb. You can't feel it. I cannot give you that again in the future if you were to detransition. Let's talk about the details of this surgery. This is a brochure that I will give you in the office today. Please refer to it later after this visit. And any questions that you might have after this visit, I'll be right back in and we can talk about it again. I'll make an incision at the lower border of the pectoralis muscle and curve that up into the armpit to create a more masculine appearance. If you have excess tissue between the breasts, I may have to connect the two incisions. I typically do this as an upside down V, or sometimes we can make it straight across, whichever your preference. I'll make an incision around the areola, that's the pigmented part, and make the nipple smaller. There'll be a special battery pack over the nipple, and that will need to be kept dry after surgery. There'll be drains after surgery, typically 1 or 2 on each side. I'll give you a sheet of paper that you'll empty and record the drain volumes and record them so that you can bring that into the office after your visit. This helps me to decide how and when I can remove the drains. There'll be a foam binder that you wear after surgery. Typically, you're wearing this for around 3 to 4 weeks after surgery. You can raise your arms, you can lift, you can eat whatever you'd like. You can shower and wash, but it's important to keep the dressings over the nipple area dry to allow that area to heal quickly. The breast tissue I remove, I'll send to pathology for examination, and I'll give you that report when it's available. Typically, this is on the first postoperative visit. There are risks to doing this procedure. There's always a potential for bleeding or infection. This scar can be thick and firm and may require additional treatment to allow for a softer appearance. I recommend applying silicone sheets such as Scar Away, and these can be purchased at CVS after surgery. I'll let you know when you're ready to start using them. The way the nipple feels will be numb. You won't be able to feel it. It may have a color change. It may be lighter in color for the first 6 to 8 months after surgery. Sometimes that color does not return and may require tattoo. This procedure may be covered by insurance, but if it is not, it's typically $100 per side. The nipple will not have the projection. It will not become erect with cold or sensitivity. If you were to gain weight after surgery, the shape of the chest will become altered. If you lose weight, it will do as well. It's important to maintain a stable weight after surgery. Typically, you'll return to work around 2 to 3 weeks after surgery, depending on the work that you perform, and we will provide a work note as needed for you. You'll receive postoperative pain medication. This typically involves Norco or a narcotic, a muscle relaxant called Flexeril or cyclobenzaprine, and 2 medications that reduce your need for a narcotic, magnesium oxide and Lyrica. And these will be provided to you on your day of surgery. I'm excited to talk more about your surgery. I'll be right back in and we can address any questions that you might have.